Linda familia na marafiki dhidi ya magonjwa.
The UHC coverage journey is on. NHIF is working under the guidance of the Ministry of Health in the UHC Step Up, which presents an opportunity to secure Kenyans access to quality health services without suffering financial hardship. So take the bold step today and safeguard your families by enrolling to NHIF to ensure health for all.
Well, President Uhuru Kenyatta today emphasized on the importance of the universal healthcare coverage. What is the universal healthcare coverage itself? Today we'll be talking to a very vital organ that will be running the show itself, none other than the National Hospital Insurance Fund, or you may know it as NHIF. Joining us this particular morning is none other than the CEO himself, NHIF CEO Dr. Peter Kamunyo. Daktari, karibu sana.
Thank you very much, and asante for having me here.
Welcome. The first question will be to you, Daktari. How has the NHIF journey been towards realizing the universal healthcare coverage itself?
NHIF, and I think the first thing that we should celebrate is enactment of the bill. And now it's not the National Hospital Insurance Fund, but National Health Insurance Fund. Meaning that now what we are addressing is the entire aspects of health. And to your question, universal health coverage. What is the spirit of universal health coverage? The spirit of universal health coverage is that every Kenyan, regardless of who you are, whether you're Mama Mboga, whether you're a farmer, whether you're an executive, that you have access to the quality healthcare that you need without suffering financially. That is the essence and the spirit of universal health coverage, that all of us can be able to access quality healthcare without suffering financially. So what does that mean? It means that if you go to hospital and you're able to pay for all your care, then you have that state. But is that possible? No, it is not possible. It is very hard, and you've seen even from very wealthy people, they're unable to carry that burden of paying out of pocket for healthcare. And that is why, as NHIF, as you said, being the driver, the government has adopted this scale-up towards getting every Kenyan covered to an insurance model, or what we call output-based financing. What this is, it means that for all of us, we transfer the risk of healthcare expenditure to a third party, and in this case, it is NHIF. So by transferring that risk, and you saw even in the bill that was enacted and assented to by His Excellency, that every Kenyan above the age of 18 would be obligated to pay for insurance. That means we transfer that burden to NHIF, and therefore everyone is protected. Now, in terms of that, because we as an insurer are paying for a service, then on the other end, there has to be service provision.
Yes.
And you have seen the efforts of the government through the Ministry of Health. And even in the last State of the Nation address, His Excellency emphasizing on the efforts and the infrastructure that has been put in place to ensure that service provision is there. So once you have service provision, we have our Kenyans, we have NHIF, and our Kenyans are paying that little premium of 500 shillings a month. They're able to access services. And for this to work is also in partnership with the entire ecosystem of healthcare, which includes the private providers and as well as the faith-based providers.
Given that you have talked about that keyword, being the driver of UHC itself in fully realizing and helping the president to reach this particular goal, his legacy goal, you might say it, but how is it looking like for the NHIF itself being the driver of this particular program itself?
Yes. Great question. Being the driver, and we go back to the spirit.
Yes.
So the spirit is that everybody who can pay, to pay. And those who cannot pay, to be identified and supported. And as you have said, His Excellency the President, from when he took over power, that has been a key focus area. And also because of the understanding that the risk transfer is important, when you look back to even 2014, the first attempts of ensuring that those who cannot pay are identified and supported through the health insurance subsidy program. And this was targeting who? This was targeting the orphaned and vulnerable children. It was targeting the elderly and severely disabled. So basically, from the onset of the tenure of our Excellency the President, it was to identify those who cannot support themselves and be able to provide them an opportunity to access quality healthcare. And this has been shown by the recent development, and this is what we are looking forward to launch, that all the indigents in this country, and it is embedded in the NHIF Act amendment, that they be identified and supported. And the government has taken the first step by identifying the first 20% of the total number of 5.1 million indigent households in this country to be supported. And from 7th of January, after they were paid for, they are able to access services in our facilities. So you can see that the journey for UHC, universal health coverage, where everyone can be able to go to an institution of health and get services without suffering financial hardship, has been a key focus of His Excellency the President.
Now the main question will be now, how impactful will this program be in the coming days?
In the coming days, what we will see is that every Kenyan now will have that opportunity. I think the first thing is that for Kenyans to also understand what this actually means for themselves as well as for their loved ones. It means that with a valid NHIF cover, you can be able to walk into our comprehensive facilities, comprehensively contracted facilities, and walk out without paying a single shilling for quality healthcare services. And this is a concept that we hope that also Kenyans understand, because I think previously in the past, because NHIF has been open to all Kenyans through the voluntary membership, but unfortunately, even understanding that you can insure yourself, you know, for something that might or might not happen, is a key concept for people to understand. But when we have everybody covered, it protects you, it protects me. Even those who are wealthy might say, why do I need the cover? But they also support other people who do not have enough funds. And that is the spirit that which we want to ensure that we are in a state of universal health coverage. That also those who have can support those who do not have, and not just also leave it to the government, in the spirit of leaving no one behind.
As you put it, this will benefit millions of Kenyans out there. Now, the other question will be, have you been able to create public awareness, given that so many people are still asking out there, what is the universal healthcare coverage itself? Have you done enough public awareness on this program itself?
Well, you know, awareness, behavior change is something that is progressive. We have made very many efforts to ensure that we pass on the message to everyone in that ecosystem. From the legislators, that's where the bill was passed, to healthcare providers, and also to the public. And one of the key things in terms of the way we are getting to our members is through the reforms that we have been undergoing, especially since 2018. Yeah, and in these reforms, I would say there are 4 big buckets. And the first bucket actually is the digital transformation. And one of the main aims of the digital transformation is to be able to get to everyone to the end of the mile, to ensure that they're able to interact with NHIF properly. And how is that? Number one is we have ensured that you can register using your mobile phone. We have ensured that you can be able to change your facilities using your mobile phone. We have ensured that you're able to see when your authorizations go through or when they're not. So all those complaints of my authorization has not gone through, has the hospital sent it, will all be a thing of the past. And members and patients would be able to get that interaction. In addition to that, you know, in the old era, working with the cards, and the card used to be for the principal member. So if a sibling or if a child is sick at home or the spouse, the owner of the card needed to go to hospital to present the card. Now that is a thing of the past. Now with biometrics, you can go to the hospital and using your fingers, you're able to access services. So that has increased the access. Yeah, and this is part of the communication. So because of that, now members are able to interact with NHIF a lot better. Then in terms of our key stakeholders, who are the providers, we have now transformed to electronic claims. Meaning that they now submit their claims. Paperwork, also a thing of the past. So what does this mean? It means that we are able to pay faster, so they're able to continue giving better services. We are able to also reduce on the fraud that has been happening in terms of, with the paperwork and falsified claims, etc. So this digital transformation has connected us to our members, our stakeholders a lot better. So, and that has improved also the communication. And also in the digital space, we have state-of-the-art customer experience center, which operates 24 hours. And in these 24 hours, you can call toll-free, you can text, you can email, and our team are able to respond to you. So this is one of the ways. And it would be interesting to know that in the last 2 years, like in May 2020, we're handling only about 200 calls. And right now, per day, we're handling between 3,000 and 6,000 calls. And I'm expecting that number to even go up. But this is also supported by our branch network, because there are also many people in very many remote areas that also feel that they need that personal interaction, or maybe they might be unable to operate digital or mobile phones and digital equipment. So we have countrywide 70 branches, fully fledged branches, and another 31 satellite branches. And in addition to that, we are present in about 34 Huduma centers. So this is a wide network of 156 service outlets where our members can also interact one-to-one. And that does not leave the media that we're using now. And that is one area that we want to enhance, to make sure that in the radio stations, on the TV stations, and this event that His Excellency the President is going to grace as we are scaling up, will be one of the ways that we use to amplify the journey that we've been on, especially during his tenure.
Now, since the rollout, you do remember last year, President Uhuru Kenyatta, of course, leading the NHIF, the Ministry of Health, and of course, ensuring that UHC goes around the country so that people can know about it. Yeah. How has the response been like?
I would say the response has been great. And as we circle back again to what universal health coverage is, that everybody has access without suffering financial hardship. If you look way back to the year 2014, for example, we just had slightly over 4 million members. As at end of the last financial year, we were at 13.9 million principal members. So we are talking about close to 3-fold increase in membership. And right now, we're looking at that membership growing, because our target is every Kenyan. And now with the enactment of the NHIF Amendment Bill, we're seeing that to get to the universe of Kenyans. And that is the target. So UHC, Universal Health Coverage, is not an event right now. It's not an event that you're switching on next week. It's not a project. It's not a project that we are in. It is a journey that we have been on. And you can see the progress as we are getting towards everyone being onboarded.
And of course, given that you have just said that you have a humongous list of beneficiaries across the country, many of them will be wondering, given that the UHC will be scaled up next week, they're asking a lot of questions. Are we going to register again? Paint a picture for us and for our dear viewers how it will look like. Do I have to register again, given that already I'm an NHIF member? Will I be using that NHIF card or the ID card itself?
Yeah. Every Kenyan is an eligible member. Eligible. And for you to be a member and enjoy the benefits that we have continuously improved. All you need is to pay the premium, which is 500 shillings a month or 17 shillings a day for an entire family. And for those of us who are employed, it's a statutory deduction. Now, those who cannot pay will be identified. And this is a process that has already started. Of the 5.1 million indigent households in this country, those, and indigent means those who cannot afford basic necessities of life, including healthcare, have been identified. And 1 million households have been identified through the Ministry of Health, through the Department of Social Protection, and through working in close collaboration with the Council of Governors and the counties to identify in each and every county those individuals who cannot afford. And they've already been registered in our system, and from 7th of January this year, they're able to access these services. So to all Kenyans, and the bill now has been made in such a way that it has enabled now all Kenyans to be on board. By one, obligating. By two, in case of default, because we know things can happen. You see what happened with COVID, people lost their jobs, etc. That even the penalties have been markedly reduced, so that to ensure that at all times we're able to carry all Kenyans. And you mentioned something about the cards. Now that we are biometric, you actually do not need the card to be able to access services. Your fingerprint, your biometric, will be able to give you access, not only to you, but also to your dependents. So what we are looking at is, and this is the spirit of universal health coverage, is leave no one behind. Whether you're indigent and you cannot afford, whether you're an executive, whether you're a public servant, everybody will have that access.
Given that you're talking about two keywords, affordable and accessible, you know, many Kenyans now will be asking, I know many questions in their head, they will be asking, what assurances do we have in accessing this particular affordable healthcare, given that in the past we have heard that so much promises from our leaders, from NHIF, from very vital organs in the country. What assurances now do we have?
Yes, the assurances is in the journey that we have been traveling. Having access means that there are facilities that you can attend to, facilities that will accept the NHIF card. Right now, as we are going into the new contracting cycle, we have 7,666 providers on our panel. About 70% of them are public facilities, and the others are private and faith-based institutions. What we are looking at is continuously reviewing our engagements to ensure that this provider panel is always present and working for our members. And that is very key. But we also remember, it's not just having the facility there and with a contract. It is the services and the benefits. And this is one of the greatest achievements that we have had, that NHIF has been continuously improving on the benefit package to ensure that we address the needs of Kenyans. If you look back to 2015, because that was a monumental change from what NHIF used to be before, for us paying only for bed rebates, so bed days. From 2015, and this is within the legacy of His Excellency the President, we started having outpatient coverage. We introduced packages that were specifically addressing the needs. And one of the key ones, and a major success, is like dialysis or the renal care package. And you have seen it has saved many lives from then to now. And even with the Ministry of Health and the government managed equipment scheme with the dialysis machines across, and NHIF being able to reimburse the facilities to be able to sustain. So basically, as we are increasing the benefits, another benefit that is very key is like the cancer care, oncology treatment. Right now, any Kenyan who is a member of NHIF and unfortunately has cancer, you have access to not only diagnostic, to chemotherapy, to radiotherapy, and all these packages have been onboarded. We also know there are challenges to do with mental health and addiction, etc. we have a package for rehabilitation. So, and for the common things like surgical issues, we have also included those packages. And one of the key ones, and this is like for our ladies, the Linda Mama, whereby every Kenyan, every person within the borders of Kenya, and this you don't even have to be a member of NHIF, who happens to be expectant, has access to supervised delivery. And this has been a success in terms over 4 million women have been registered, over 1 million deliveries, which ordinarily would not have had access. So basically, as we show and demonstrate this journey, whereby the needs of Kenyans, their health is being addressed by the government, and having that access by the transfer of risk to NHIF through insurance. That is why we say in this journey, we need to make sure that everybody is a valid member, and on our end, we make sure that we address our stakeholders to ensure a seamless service, to ensure that they are able to get the services that they need without financial hardship. And this indeed is embedded in our constitution, Article 34A, 1A. So it is, we are also being lawful by doing the right thing to ensure all Kenyans are covered.
Now, given that you have painted a picture of how the journey is looking, it's looking illustrious, but I'm sure along the way you have had some bumpy roads ahead. How were you able to maneuver around them, and in the future, what measures have you put in place to ensure that you do not meet the same challenges as before?
Yes. Indeed, as we have evolved, we have had, as you mentioned, a bumpy ride. And this is because the environment that we're in is dynamic. And as I've mentioned, moving from a very simple model of rebates to a complex insurance model is bound to have its issues. And indeed, in 2018, the HEFREP reforms, Health Financing Expert Panel, that came up to ensure that we transform NHIF to become a strategic purchaser of healthcare services and the vehicle towards where we are heading to now, vehicle towards universal health coverage. So these reforms is a reaction to those bumps on the road to ensure that we adapt to the changes in the environment. And I'll mention one of them, like the organizational transformation that we are currently undergoing, to make sure that the staff are aligned to core functions, to make sure that patients, when they go to hospital and they call, there's somebody who is an expert on the other side of the line to be able to guide them, to interact with the doctors through our case management, to ensure that the team that is doing our quality assurance and contracting of facilities is fit for the task and also aligned without overlaps. And this has been a reaction. And also, because we are an insurance, this is a financial institution. Financial prudence as well. And it would be great to mention that, for example, our administrative fee, in the last, since 2017, when it was at 22%, in the last financial year, dropped to 11%. And we are looking at, by the time we get to the state of universal health coverage, it will be as low as 5%. Because the funds that we collect, that all the contributors make to us, the aim is to pay for the services that they get at our hospitals.
And of course, given that we're talking about funds, you have just brought it up, measures of accountability you have put in place as NHIF itself, given that we do understand that you'll be receiving tunes of billions every year once this program is fully realized and upscaled by next week. What measures have you put in place to ensure that you manage those funds well?
Yes. Number one, good corporate governance, guided by our parent ministry, Ministry of Health, the principal secretary and the cabinet secretary, but also in the day-to-day, our board of management, led by our board chair, including the board. Now, these are the first instruments of the good corporate governance. In addition to that, it is accountability. And the model of output-based model or insurance model actually does ensure that, because the funds that NHIF receives is not from the exchequer, it's contributions for the members, and it is a premium. So even those who are supported every fund that is received is equated to a member. So all the funds is a premium, and already on that premium, on that valid member, there is a promise of a certain set of services. So the accountability is in our reporting that we do regularly to ensure that funds that we've received and the claims that we pay out and to whom is being able to be verified. And this, even as was also enacted, that it should be information that will be public. So I am very happy that with the structures that have been put in place to ensure that we are able to have transparency and accountability, because as we scale up to ensure everybody is covered, all these premiums must be put to the use that they are meant for, and that is to pay for services for our fellow Kenyans.
Given that we're entering the final leg of this particular conversation, now I'll ask you the feedback. How are you going to collect the feedback from many Kenyans? I know you have told me that you have a toll-free number, you can call in, but you know physicality is everything. Talking to the people personally, getting their own views. As NHIF, what plans do you have to ensure that you get raw feedback from the people you're serving?
Yes. Feedback is very key, because it's through feedback that we've also been able to adapt and change and be responsive to the needs. And it is also interesting now that we are covering the entire country, and feedback is received differently from also different communities. And we have come to realize that fact. So even right now, as we're scaling up for UHC, we have teams from our communications and marketing as well as our operations team engaging the groups on the ground to find also what is the best way of communicating to them. There are certain communities, especially in the urban areas, you'd find social media works for them. So we are able to get a lot of feedback, and nowadays we get real-time feedback on that. But there are certain areas that you'd find they would rather listen to their community elders and collect feedback from community elders. So we are incorporating in our integrated communications and marketing plan as we go into UHC, we're incorporating all these tools, because the key thing we want to achieve is behavior change. And behavior change to understand that by being a valid, continuous member, protecting yourself from the unexpected occurrence is very key. But also at the same time, that you're able to communicate with us so that we are able to react in good time, to be able to help your experience to be improved, because at the end of the day, what we are looking for is a healthy Kenya. And we know a healthy nation is a wealthy nation.
Very indeed, very true. Given that now we are in the final leg of itself, as you give your final remarks, what are we supposed to be looking for when it comes to the upscaling of this particular program in Mombasa, of course led by President Uhuru Kenyatta?
Number one is celebrating the journey that we have gone through. It has not been easy, as you said, it has been bumpy, but under the guidance of His Excellency the President, there has been a focus to ensure that every Kenyan has access to quality healthcare. So for us, that is the celebration that we want to have of that journey to get to universal health coverage, and to demonstrate the milestones that have led us there, and also to demonstrate what we have in store in terms of achieving this legacy of His Excellency the President, where the focus, which is in the spirit of UHC, is leaving no one behind. And this has been demonstrated by all the arms of government working in concert. You have seen the scale up of hospitals across, and not only from the national government perspective, also at the county perspective, with the county hospitals and the governors and the CECs who have been working very hard to ensure that we support this ecosystem. And at the end of the day, ensuring that by enacting the law, that we have people covered and NHIF being able to pay for their claims as they get and access these services that we have made available to them.
Dr. Peter Kamunyo, thank you for painting a picture for us on how that particular program will be looking. Thank you so much for your time. And of course, there you've heard it from the NHIF CEO himself, Dr. Peter Kamunyo. Have you been able to understand a thing or two about the universal healthcare coverage itself? Have your questions been answered? Of course, this is something that will be continuing with all the vital organs that will be spearheading this particular program till that particular day. President Uhuru Kenyatta, of course, will be lifting up this particular universal healthcare coverage he has been talking about since time immemorial. Thank you so much for joining us. And of course, next time we'll also be talking how trivial the NHIF bill will be to this universal healthcare coverage. See you next time.
Linda familia na marafiki dhidi ya magonjwa.